Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi, everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. I'm in Burrowang in New South Wales, as you all know, and it's cold. It's the middle of winter outside. I was just telling my guest, who I'll introduce in just a moment, that it was 11 degrees but feels like 4 degrees outside. So it's cold, but it's not snow temperature. Anyway, my guest today is in Singapore, where it's hot 365 days of the year, and gives me great pleasure to welcome to the studio Alicia Flynn. Alicia, thanks for joining me on the Ultimate Dental Podcast. So great to have you as a guest. Welcome.
Yeah, thank you. Thank you so much for having me here. I'm excited to do this podcast with you. Thank you.
Now, Alicia, straight away, anybody who's watching or listening to this podcast would say, she doesn't sound like she's got a Singapore accent. And if they're watching or listening, if they're watching, they'll say, she doesn't look like she's from Singapore. Alicia, where are you originally from? Tell us your history in terms of where you started out and how you got to be in Singapore. But
Okay.
just before you begin that, the reason I invited you on the podcast was that your LinkedIn profile was very, very exciting. You came up on my LinkedIn feed. You're a dental practice growth coach, and your byline was that you turn hygiene into a profit center. And I thought, well, that's something that every dentist needs to know, because it really is something, dentistry is a business, and businesses survive by making profits. And it's much nicer to be employed in a business or to own a business that makes a good profit rather than one that struggles to make a profit.
Yeah.
So I thought, I need to find out more about you and what you do for dental practices. But let's go back now to that question. How did you get tell us your story in the US and how you got to Singapore? And there's also a lot of backstory along the way. So Alicia, over to you. Let's start at the very beginning.
All right. Well, we'll start at the beginning. I'll give you a condensed version, but it started out, I was born in Portland, Oregon, and my dad was a dentist, and he trained me and some of my siblings to be dental assistants. And we lived on a very small town that was a bedroom community to Portland, but also it had a lot of timber town people. We did lots of woodwork and things along those lines. And sometimes there would be emergencies, and my dad would bring us down and he would train us to be assistants, and we would help put people back together, sometimes due to a bar fight, sometimes due to just neglect, but we would treat people. I remember going down Christmas Day and taking care of a little boy who had been up all night crying because of tooth pain. And so I started out at the age of 12 working in a dental office. Then later on, I married my husband, and he was in the military. So we lived and had opportunities to live all over the United States. So we lived in Colorado, Indiana, Texas, Idaho, Utah, Oregon, and Idaho. So all over, and just so many experiences. And with that, I had opportunities to be a dental assistant, to work in specialty practices, also to be an office manager, to be a hygiene assistant, and later I got my hygiene license. So I've had opportunities to work in pretty much every aspect of the dental office except being a dentist. But I've loved the opportunity to help take care of people. And what I learned was my father as he became sick. And when he was 77, he was still practicing. And 6 months later, after being diagnosed, he passed. And is what we learned is that he did love taking care of people. He loved being needed by people and helping them to get to health. But his practice, his dental practice, really was more like a prison to him. He was trapped in his dental office practicing because he needed to, not because he wanted to. And what I took away from this is that I don't want your story to be his story. I want you to have the practice you dreamed about, but also to have a practice where you get to choose if you're going to work 1 day or 2 days a week, or if you want to work more than that, but that it meets your needs. Because this opportunity to be in healthcare and to be needed by patients and be available to help them is amazing. It's a wonderful place to be, but we have to have the right structure in place to be successful. So that way the practice is a joy on every level and not a burden.
I think thank you for sharing that story. That's a very sad story to hear about your father, and he was still working and at the age of 77. And then, as you mentioned, he was diagnosed with a cancer, and that was a quick death in terms of only months, not years. But he was living what Omar Reed told me in 2010, and that was that Omar Reed said to me, he said, David, at the age of 65, 95% of dentists in the US can't afford to retire to a lifestyle that matches their dental income, either because they haven't saved enough or their lifestyle is still too expensive. And when he told me that, I was 51, and I thought, I'm in that 5% already. I'd planned, not so much by good planning, but just, I got good advice early to start putting money away, when I was 30, and that had set me up on this road of make sure that you save for that retirement. So your story resonates very much with me in that, as I said to you before we started recording, I believe that dentistry is a gift, and because it can allow you, if you manage your practice well, to live where you want, work where you want, send your children to the schools that you want to, and then retire when you want to where you want to, and then enjoy that retirement as well, as long as you plan. The trouble is that most dentists, or most people actually, Alicia, spend more time planning their vacations than they do planning their work life. And I don't mean that to be a bad thing, especially in talking about your father, because he obviously loved helping people, but sometimes he hasn't realized that he needs to financially look after his family and his future, and to be working into those late 70s. He was lucky to be able to still be able to work, because some people physically can't work to that age, with arthritis and backs and eyes and necks, all sorts of things can go wrong. So it's testimony for you to pick up the chalice and then run with it to help dentists. You made a very good comment there, and another dentist told me this. He said, dentistry really is a unique business to own. He said, because if you're a baker, you've got to bake bread 7 days a week. People expect the bread 7 days a week. But if you're a dentist, you can wind it down to whatever you want. 1 or 2 days, you will still have people who will be loyal to you, even on those part-time, even if you maintain the office and build the office up, and other people do the dentistry on the other days. So that's something that dentistry does have over retail and food supply as well. But back to you, because I guess you've been consulting now for a reasonable amount of time. So as well as working in different offices every time your husband got redeployed or reposted, you would have seen a lot of different sorts of practices and offices, and you've also worked in different roles in those offices as to how they operate. Some have systems, some have no systems, and sometimes it's quite scary to be an employee there, let alone to be a patient when nobody seems to know what's going on. So what have you seen in terms of mess versus hot mess, back to systems, and then what have been your aims as a coach in terms of helping dentists to run better offices?
So I think the number one thing I see is communication, is that the dentist isn't sharing his vision of where he wants the practice to go. What we're seeing is, like, today we're going to treat these patients and we're going to get them better, and then the next day we do the same thing. but there's not a structure and there's not a goal. And so the schedule is crazy. It's all mixed up. You have all these short appointments back to back to back, which is really frustrating for the back office. But also, you don't have a lot of joy in that as well, because it's a lot more enjoyable to go in to do a surgery and walk out feeling like, yes, this was successful, or to do a larger case and then intermix that with the other smaller cases. But it's the way that we communicate with our staff and let them know this is the goal of our practice. This is what we want to be known for. What type of practice you want to be? Do you want to be a practice that is a preventative practice? Do you want to be the practice that people go to for aligners, for cosmetic work? What do you want people to speak about your office when they come and people say, oh, you should go to this practice? What's the one thing you want them to say so that you would want them to identify your practice with? Because once you have an identity and you know where you want to go and your team knows where you want to go and you're communicating that clearly, you're more likely to be successful, because that's what your team needs. And honestly, that's what almost everyone wants. They want to be successful and they want to help the dental practice and the dentist to succeed. And that happens with communication.
So I love that you took that word communication and you took it straight back to the first thing that dentists need to communicate is their vision, because there's so many practices where the staff have no idea what the vision is, the patients have no idea what the vision is, and it just becomes a rabble or a mess without clarity. And so if you've got a good practice, people know this is the place to go for this or for this. You're going to be looked after, your fillings are going to last. And primarily that's what the public hope. They believe that all dentists have the same level of skill, and so they want to find the dentist who's going to be gentle, approachable, and also competent, that they don't have to keep coming back. But Alicia, I've seen practices where patients come back, they don't make a co-payment, so it's only their time they're missing out on, and the dentist is replacing the same fillings every year as they fail, but the patient's not paying anything, so they feel like they're getting that this is how dentistry is meant to be. I bet you've seen something like that as well. Yeah. I can see you raise your eyebrows there. Yeah.
Yeah, I don't want to, I'm not going to call anyone out on this, but yeah, we've seen, I think we all have, we've all seen practices where the treatment that's given isn't up to successful, where it's not going to last more than 3 years or 5 years. I've seen dentists who weren't doing, one of them wasn't doing using etch before a composite filling. And I was like, oh my gosh, like I was working as a dental assistant. And so I I danced around that a little bit because we had to recognize that he was missing a step and just to talk to him like, why is this used? And then I talked to a sales rep and brought them in on the conversation, because I was like, tell me more about this. And then we were able to fix that situation. But it's tricky being the employee, knowing that something has very much gone wrong. And how do you fix that without offending your employer? So I wasn't there very long, but it was just something that I saw. I was like, I can't walk away until this is addressed. So that was something that needed to be addressed and was addressed. And I'm very grateful that we had that opportunity to address that situation.
So let's go back to the practices that you've worked at where there's been a clear vision set by the dentist as to what he wants the practice to be. And I've seen this from my education in customer service, and you would have, I know you've recently read my book, so you would have seen this, that the leading businesses of the world, not just dental practices, always have a clear vision, and that vision then determines who they hire. And once they get the right team, then they start giving them the procedures. It's much easier to train people with the vision, people who have the vision, than to have people who know what to do but have no vision or don't share the vision. That's also very important. The cliche is everybody singing from the same hymn book. Everybody drinks the Kool-Aid. But customers of a business know when everybody's on the same page and when it aligns with what their expectation from that business is. And you were talking about having poor schedules and having patients jammed in anywhere. And yet a lot of dentists are fearful that an appointment may be too expensive because they do too much in it. But if you ask every patient, would you like to have these 10 fillings done one at a time or in as few visits as possible? The answer is 100% as few visits as possible. So why are they doing them one at a time and then having to do the washing up and the setup one at a time? It doesn't make any sense.
Yeah. Yeah. And it's just communicating with the patient and letting them know, finding out what the patient's goals are, what's their biggest barrier, and then communicating that with your team. But yeah, getting people, this, unfortunately, they don't love to come to the dental office. Like, how many people do you say, like, I'm going to the dentist, and people are like, oh, you're so lucky. Like, yay for you. Like, I wish I was going. Like, it doesn't happen. So we need to change that a little bit and make it so it's fun, as enjoyable as possible to come to the dental office, because really is what we're doing is we're either getting them to health or we're keeping them healthy. And everyone really wants to be on that board. Everyone wants to be on that boat because we want to be healthy or we want to become healthy. And when we teach our patients that and we communicate, and if that's our goal of where our team, of what the practice wants to go, then communicate that. Make it about the patient and their health, because that's really why we're there. We're there, yes, to be profitable, but we're really there to help people to become healthy, to become healthier than when they were when they walked in the door.
It's great that you've brought that word in. It's a 6-letter word, health, because often dentistry is seen as a repair. When I graduated, we were talked amongst ourselves as sometimes what we're doing is really tooth panel beating, and the mouth was seen to be separate. It was inside the body, but it was separate from the body. Whereas we now realise that there's so many things that go on inside the mouth that not only are reflective of body health, but there's a causal factor as well. Periodontal disease now exacerbates diabetes, and diabetes exacerbates periodontal disease. So every person, 50% of the population have some form of periodontal disease. Only 3% of the population get told about it. And so hygiene is really underutilized, underpresented, undersold as being beneficial. I remember when I began, because of busyness down here, a lot of dentists just start doing cleans because that's what they do, and having to expand my practice and put in a hygienist. And my wife said, David, she said, having my teeth cleaned by a hygienist it's as enjoyable as having a facial. And so that was the line I used when patients say, but I want you to clean my teeth. I say, look, my wife says it's just like it's like having a facial, and you don't want me to be giving you a facial. Yeah, you're probably right. And so selling that luxury, but more importantly now, Alicia, it's about education that hygiene is about health, and it's not just a clean. It's only a clean. I'm only having a clean. Everything's okay, because it is something. It's a checkup for their health, more importantly, and that's again. I'm segueing now into what you do now with educating hygiene departments as to the benefits of what they need to do and how they need to work with the dentist to improve their patient's health, and for them to for the patients to respect that their visit to the hygienist is a checkup on their general health.
Yeah. So I'm going to tell you a couple of things from here, and that is, I don't usually call a cleaning. I call it preventative treatment, because it's preventing them from becoming unhealthy. And so because when we say cleaning, people think, well, yeah, I brush my teeth and sometimes floss at home. That's not what a hygienist does. Hygienist does so much more than that. So I prefer not to use the word cleaning. I kind of use it like a swear word. Like, I prefer to use is preventative treatment, because we're there to keep the patient, either keep them healthy or return them to health. And then from there, this is where we need to align as the hygiene department and the dentist, as far as how preventative do we want to be with patients. We need to decide, if we have a 4mm pocket, do we do treatment? Is it 5mm? What do we do at certain steps? Because if we're communicating clearly and understanding what health is, because every office is different. Some offices will say, oh, we don't do anything, we'll watch it. Other people say, we'll bring them back in 2 weeks and do a tissue check. It's up to you as the practice owner, as the dentist, to decide how you want to go and how you want your practice to be aligned. But understand this, that the mouth, I call it the beautiful tropical jungle. It's got this warm, moist environment, and microbes are like going crazy in there, right? And so we need the mouth to be healthy. And I like to look at patients' health histories. And I like to see, do they have a respiratory issue? Because if they do, that's a perfect opportunity for me to speak to them about how we breathe in through our mouth and that bacteria gets in their lungs. If they have a heart condition, I can speak to them about how that bacteria collects around their valves in their heart and the condition around their heart, making them at risk for heart attacks. I can speak to them about strokes and the risk of strokes because of the bacteria that's in their mouth. There is so much more that we have learned, but you need to be aligned. If you want to go that way, you have to be aligned as a team. Now, if you don't want to do that as a team, there's other things that the dentist and the hygiene department can do to still be aligned. And that is where you co-diagnose, where the hygienist gets to prep the patient for treatment, if you will. And one of the ways I like to do this is after I take x-rays and while I'm cleaning their teeth, if I see something suspicious, I'll point it out to them, or I'll just point in that area and say, this tooth up here on the upper right, all the way in the back, I don't like the way it looks. I think there's decay around here or you have a crack, but let's see what the doctor has to say. But what I'm doing is I'm prepping the patient for treatment. Because if the dentist comes in and I haven't said anything for 30 minutes and I've been in their mouth and suddenly the dentist says, this tooth needs treatment, the patient's like, well, why didn't the hygienist say anything to me? So you need to know where you're aligned. You need to know what health looks like and you need to know what sickness looks like. And you also need to know what restorative treatment, what is best for the patient, and what is not best for the patient. So knowing what their health history is and what the patient stands in need of, you're going to do better. And you're going to make mistakes, but that's all right because you're going to learn. And as long as you're learning, you're going to be winning. I love Morgan Freeman's quote. I'm trying to think, we either learn or we win, but we never lose. And I think that's so true. When we speak to our patients, we need to speak to them about health. Some of the patients will not accept treatment, and that's okay. A lot of times we take it personally, like, oh, they rejected me. No, they're just not ready yet. So don't worry about a patient saying no. Patients are going to say no, but as long as we continue to revisit and explain to them treatment that's needed, you can even send them an email link and say, I'd like you to read up on this. I just want you to understand why I am so concerned about your health. But there are so many different ways we can communicate with our patients to get them and get the team aligned first. Get the team aligned on where you want to go. And then that will bring those patients to you as you get them aligned to health and to the practice that you desire. That was a long answer. I'm so sorry.
No, that was great because your passion is showing through, and you reminded me in that conversation. I'm just trying to think. It was early on in my employing of a hygienist, and I had a new hygienist, and I came in to check the patient's teeth after the hygienist had done the preventive treatment, as you call it, and
Good job.
and the patient had a lower right first molar missing and a lower right second molar, the mesiolingual cusp was missing. And so very easy to see because there's nothing in front of it. And I said, the first thing I looked in the patient's mouth, I said, oh, you've got a broken tooth down here. And the patient goes, have I? And I thought, my head nearly did a Linda Blair, It was like to the hygienist, what have you been talking to this patient about if you haven't been saying, hey, you've got a broken tooth down here? And I understand exactly the benefit of the hygienist working as the identifier of issues, be showing the patient, pointing something out on an X-ray, taking a photograph, and saying, "I'm going to get the doctor to have a look at this." And it's so easy to give them authority and also educate a hygienist, because sometimes hygienists say, "Well, I can't diagnose." I'm thinking, when back in the day when my wife was pregnant, she'd go to the radiologist, and the radiographer would be, examining her, and she'd say, "Can you see if it's a boy or a girl?" And she goes, "Oh, I can't say." Well, we know that she knows what she's got to do because she's not going to present bad images to the radiologist. So we know that she can read an image. She's just playing it safe. And so I say, you can say to the patient, I've seen in past cases when I've seen something that looks like this, Dr. Smith has recommended a crown, to protect that tooth. But let's wait till Dr. Smith comes in and see what he says. So you're planting the seed, as you said, but you're still. And then when Dr. Smith comes in, and this used to happen to me, I'd walk in, I go, "How are you today, Mrs. Jones?" And she pointed at the screen and go, "I need a crown." That'd be the first thing she said. I go, "Really? Is that what she said? Is that what the hygienist said?" She goes, "Yeah, that's what she said. Let me have a look. Well, let's put the chair back." You know what? I think she's right. Yeah. So my job's done a lot easier. Whereas, if I come in cold and that seed hasn't been planted and I say, you need a crown, they go, golf fees are due, are they? Or school fees are due? Or and then another holiday, do you, Doc? So you've got to work together because, and sometimes they're only joking, but they still, I've seen TV comedy shows where they show dentists saying, oh, yeah, I can see a TV here and a set of golf clubs here. They send us up. And really, the last thing about this is Alicia, no dentist likes having the fun. They're easy targets. There was a Billy Crystal movie where he and his wife broke up and his wife started going out with a dentist. Now, this guy the character never appeared as a real character. He was just referred to. And Billy Crystal would say, can I ask you a question? He'd say to his ex-wife, he said, does he play the same music in his home as he plays in his office? Really put the dental profession down. But a lot of people wouldn't want to be a dentist for quids, for just the idea of the environment they have to work in. So it's nice to, as you said, to set that vision, set that expectation, but also work on the education of the patient, that we are talking about their health and primarily that's it. Even today, one of my clients said, what do we say to patients when they say, well, it's not hurting? I said, well, let's talk about, I said, a friend of mine, ours, who we hadn't spoken to for a while because we relocated out of Sydney, rang and was talking to Jane, and she said, my 27-year-old daughter, and we're going, my 27-year-old granddaughter had a shadow appear on her pancreas in a scan for something else, and it was a cancer, and they took this piece of pancreas. It was enclosed, so it hadn't spread, nothing. They got it out, and got it early, because once that gets bigger, it can it's a death sentence. Pancreatic cancer, ovarian cancer, sometimes they are a death sentence when they're discovered, and yet those breast cancer often don't hurt. So let's talk in the same language. Just because your tooth doesn't hurt doesn't mean it's not going to be bad for your tooth.
I like the word yet. They're like, it's not hurting me. And you say, not yet, because they'll use it as a reason to justify, to procrastinate. And we need to understand that it's going to hurt. It will. And I like to tell people, teeth love to act up on weekends and holidays, because it's true. Right? It just happens. And I just tell them, yeah, not yet. And I'm so glad, because Dr. Jones, Dr. Smith is so preventative, and he is aware of you, and he would much rather have you be healthy and not have tooth pain or gum pain or whatever it is, or gingival trauma, whatever you want to say. But it's better to stay healthy. And I tell patients, I like to tell them this, it's easier for me to keep you healthy than it is to try and recover from being unhealthy. And when I tell patients that, they're like, you're right. It's so much easier to stay healthy.
Absolutely. And we know, as healthcare professionals, that the patients who come regularly are healthier, and the patients who don't come regularly, they're just in a degree of disease or one of my colleagues said, any word that ends in itis is bad for you. You shouldn't have it in your body. You have bronchitis, encephalitis, periodontitis. We've got to really identify that this is what they've got, and we've got to fix that. The other thing that's exciting as scientists, because that's what we really are, is the discovery that there is now this pathogen from P. gingivalis, this excretion that has now been seen to pass through the blood-brain barrier,
Yes.
and the link between periodontitis and Alzheimer's as well.
Yeah.
And so that's scary. That
It's
now
terrifying.
there's a reason to keep going to the dentist. Yes.
Yeah, no, it's terrifying. And it's important. That's why that health history matters so much, by having that history. And then even if maybe they're clean as far as their bill of health goes, but asking them about their family. Like, does your family struggle with any, if they know a little bit more about the family history, we can speak to them about what they want to avoid. So we can go to it from lots of different angles, but it's frightening what we're learning, but also it's wonderful, because we have now this opportunity to see patients in a way that we haven't been able to treat them, as seeing ourselves as more preventative treatment, and someone who's able to keep patients healthier, having them have a better quality of life, because we recognize that bacteria travels throughout everywhere in the body, and we want to keep them healthy.
Yeah, I love reminding my clients to tell their patients that, the same blood that's
Mhm.
pumping through your infected gums is pumping through your healthy heart, your healthy lungs, your brain, and your baby.
Yes.
And it's they just think it's just blood in my mouth, but that
Yeah.
it is a sign of infection and it needs to be treated. Really, really important. Getting back to the specific, of focusing on you've focused on the disease in
Mhm.
that the hygienist can identify. You've also focused on the treatment that they see, the restorative work that they see. What's the importance of really building a hygiene department? Because you and I know that there comes a time, and an American hygienist told me this maybe 12, 13 years ago, that in the US, half patients over 50, more than half of them come 4 times a year now to have hygiene treatment, as opposed to the twice a year, which has become the envy of all other healthcare professionals. Pharmacists can't even get people to finish a packet of pills, and doctors can't get people to come back for reviews. But dentistry all of a sudden has this, "I go twice a year." But getting them to that 4 times a year isn't so difficult with the education. In fact, I had a temporary hygienist come and work for me. He was of a different ethnicity. He was of a different ethnicity. He was of a different gender to every other hygienist I'd ever had. And in the first day, before I even came in to see the patient, he said, "Cheryl's now coming back 4 times a year because I've identified some bone loss and she doesn't want to lose any more bone." I'm going, "Yeah, I agree. All right." It's just, I was being a bad doctor by not being on top of that. I was getting lazy with my summations.
Mhm.
And for him to come into my office and straight away assume a level of responsibility to get these people back, knowing, as I know personally, that the scary thing is that all of a sudden, as your patients turn 50, there's some form of bone loss there that is age related more than cleanliness related. All of a sudden, people who've been coming twice a year for 20, 30 years, all of a sudden they're starting to get some vertical bone loss in their 50s. And you go, "Have I done something wrong?" No. But how do we turn that hygiene department into something really serious, Alicia, that also becomes a revenue center for the dental office?
Yeah. Well, as I mentioned, first have the same vision. And then when you have the same vision, you know what healthy is, then you know what unhealthy is. And then from there, decide what is the best treatment for that patient and practicing role playing and understanding it. Ask the patient, what is your goal? Do you want to keep your teeth? Do you want to keep all your teeth? Do you want to just keep your front teeth? What's their goal? Because most patients will tell you, I want to keep all my teeth. You're like, perfect. I want you to keep all your teeth too. Make sure that what your goal is for your patient, that the patients have the same goal, because sometimes they don't, and that's all right. But once we know that, yes, they want to have that goal, then start looking at and comparing their x-rays and looking at what areas are you concerned about. Especially you have an oral health scanner, the iTero machine. I'm sorry if I threw in a name brand that I shouldn't have, but if you have a scanner system, scan and compare that tissue trauma, see if the tissue's changing. And then from there, decide, do you as a practice, do you do grafting? Do you not do grafting? Do you place medication in those pockets? Do you do irrigation? What treatment is best for the patient? And have that alignment, because there are so many procedures we can easily add on when the patient comes in for treatment that will benefit the patient. And having them easily accessible in the room makes it so that way you can provide the patient with that same day treatment. Because if you're having to get up and go get all those materials, more than likely you're going to shove it off and do it another day. And probably you'll keep doing that. But let the patient know that if they want to stay healthy, they need to come back more often, because your goal is the same as their goal. And that is to get them and to keep them as healthy as possible, but making it safe for the hygienist to recommend adjunct services, because too many practices, they get comfortable and they kind of get restricted and they're like, this is what we do and we don't do anything else but this. But really, when we get comfortable, we forget that there's something more we can do for our patients. And that's why it's beneficial to get some fresh eyes on your hygiene department, on your restorative department, because it allows you to kind of go, you know, I could have been more preventative, or I didn't realize that I'm doing this in my practice. One dentist that I worked with, really sweet man, he was referring out, I think it was around 6 implant cases each month. And I told him, I was like, why don't you start doing implants? Are you interested? And he was like, actually, I have been interested. I'm like, you're throwing money out the door. Let's just look into it. He started doing implants and he loved it. So be aware, who are you referring to? And how often are you referring to other specialists or other dentists? And is that something you could bring into your practice and offer that within your own practice that would help your practice to take better care of your patients, but and bring more joy to you as a provider, but under that also provides more profit for your practice. So it all goes together, but having that laser focus of health is always your number one goal.
I think you've touched on something there which is
Yeah.
really exciting. And sadly, when I retired clinically 8 years ago, I never used a scanner. They were just coming in, I was really great at rubber base impressions for crowns. But the scanner gives the ability to compare an image taken this year as well as last year and the year before. But excitingly, I was at a digital dentistry conference in Sydney in May, and they were talking about software where the scans of the mouth are now overlaid over a CAD cam, a cone beam. All right, so you've got the base bone as the reference, and you can then see, because you mentioned periodontal probing, you can get a different measurement from the same dentist on the same day, just depending on how hard they push and what angle they put the probe into the pocket. But with this latest software and the scanner and then the cone beam, you can actually see change and record that change and say, this is something that we need to do. And that's exciting because it is a very vague area in terms of periodontal probing. Plus, the recording of it is labor intensive. The hygienist needs to have somebody there to write it down and then have to record it. It's very mind-numbing for the patient having all these numbers called out. 3 per tooth times 32, that's nearly 100 numbers. And it's the technology is now there to look at things very objectively and be able to say, we need to do more treatment. The option, as you said, is the patient may reject this, and you can't argue with an idiot. I like to say, if they say, because they say, look, I don't want to keep my teeth. My mum, she had no teeth. She ate a steak just fine. That's pretty hard to win an argument in that sort of situation. What are you going to do? Scientifically talk about the mastication and swallowing food whole. They're not really interested in the fact that the diverticulitis they have is probably related to the number of teeth they've got missing. You just have to move on from that person. But there will be people who will appreciate what you say and will say, you know what, I'd never thought of that, and thank you for showing that. So the technology is now advancing with the scanners. The other thing with a scanner, Alicia, is that it's very easy to do, quick to do, and when you can blow up an image and put it up on a 78-inch TV and they go, gee, I didn't realize that tooth was that crooked, or gee, that's a big gap. Again, those sort of problems then become front of mind for that patient. And you say, oh, what do you think? Would you like to find out something to do about that? And then guess what? If they've got a crooked tooth and you show them theirs, they go home, they go to their husband, hey, you got a crooked tooth down the bottom there. All of a sudden it's like you're buying a new car and everybody's driving that car. It's that sort of front of mind thing. And so technology is now helping to bring, it's better than an intraoral photo because a scan, you can blow it up as big as, and also very quick. So I like I like seeing how my clients are now utilizing scanners more and more, not just for impressions and treatment, but for diagnosis and comparison. That's exciting. And for the hygiene department, again, the beauty of a scanner is that it's a camera and it can't be swallowed like an endodontic file. So anybody can use it in the patient's mouth. It's a camera. It's not a scientific instrument or a syringe. It's not harmful. And so anybody can take that record and then the record can be analysed by those qualified to make diagnostic decisions. I think dentistry is moving into an exciting time, and the hygiene department can really help in that sort of helping people maintain their health.
Yeah, it is an exciting time. Some offices use microscopes to check the bacteria in patients' mouth, which I think is fabulous. But it all comes back to, what do you want your practice to be known as? How do you want your patients to be treated, and giving them that treatment, and also aligning your team through communication and letting them know when things are going well and when you need to adjust, because there's going to be some tweaking that takes place. But this is such an exciting time to be in dentistry, to be considered as equivalent to the MDs, because too often I've seen people say, oh, well, you're a dentist. But that's not true, because we are people come to the dental office often, way more often than the medical doctor. And they come to the dentist often before they're in pain, before they're having troubles. People go to the medical doctor when they're having pain, when they're in trouble. And so we get to have this opportunity to connect with patients when they're not in that at-risk state of already being unhealthy. We get to keep them or get them back to health. And it's just a wonderful place to be right now, with all the technology we have available, and that we can use it within our office as we want to. But I also want to use, like, a little disclaimer, not to purchase too much equipment at one time, to be very careful and mindful before you purchase anything. I've seen too many practices purchase the latest and greatest technology only to have it to collect dust. So do not go out and purchase a whole bunch of equipment, or even one piece of equipment, until you have done some due diligence, because dental equipment is expensive. And to have it collect dust is even more expensive, because it was a poor investment for that office. So be buyer beware, if you will, and get your team on board before you start purchasing new technology for your practice, because it needs to benefit you as a provider and your patients, and your team needs to be on board also, because I've seen this too often where it became a burden and it was unsuccessful for the practice.
Yeah, that's the truth. The the words when looking at new technology to be scared of as a dentist buying is steep learning curve, because that certainly, if it's hard to learn, it's destined for being in the corner. I was talking to some dentists in England, and they found they had multiple offices. They found that one of their offices, the intraoral scanner was still in a box, and the box was on the practice manager's desk, and she used it as the place where she put her coffee cup.
No.
So there's an underutilization of quite an expensive resource.
Yeah. I was going to share with you. Sorry, just this reminded me of one other experience that I wanted to share. And this is one dentist I worked for. He wanted to do implants, and he went to the class and he did all this, but he didn't tell anyone on his team. He didn't tell his hygienist, his front office, his assistants. And then, like, 6 months later, when it was mentioned that he went to this class for implants, we were like, why didn't you tell us? Like, we could have been prepping the patients for, hey, our dentist here is going to do implants. So that's why communication is so important, so vital for your team. Because if you let them know what continuing education classes you're going to attend or have attended, they can then gear that patient towards you, because he eventually went back and did another class, which was extremely expensive, because he said, I didn't have a chance to practice and I don't feel qualified, which is understandable, but it was an unfortunate investment of his time and his finances, because he didn't utilize it when it was fresh, when he first had it, and didn't share that information with his team.
Yeah, looking back at my career, when I learned how to do appliances, orthodontic appliances, and then put braces on, that was a big leap of faith for me, because I was just trained as a panel beater. So I can still remember how fearful I was of sticking a bracket on a tooth. And yet, and funnily enough, I did a course 2009, I think, 6 month smiles. And I did that in San Francisco. I go, yeah, this is easy. And I went back to my office, and I didn't realize that for 6 month smiles, you're meant to take an impression and they would send you a guard with all the brackets in it, because I was just so used to just putting brackets straight on. I just thought they want it quick. It's 6 months and a month, because it's a month to get the guard back. Why would it? Like, the thing about 6 months smiles is that it's over in 6 months. So why wouldn't you just say, all right, we're going to, we're really just straightening the top 6 teeth. So it is that education. I've got a
Yeah.
client who I I met 10 or 12 years ago. No, it might be longer, might be nearly 20 years ago at a TMJ course. Never practiced TMJ and its connection to headaches and facial pain. And yet I did so much in that field. And finally, she's gone for a refresher course now. And I think that, it's there. That sort of work is there. Those conditions are present. People are just living with it. And because they don't know, and you're actually harming your patients by not sharing that information. I once had a patient who turned up. He had worn his incisors down to 1 millimeter above the incisal papilla. Like he had 1 millimeter of tooth length. And he came to me, he says, "What can you do here?" And I said, "We can open up your bite and restore your teeth with porcelain." And he said, "Yeah, we'll do this." He said, "I used to go to new dentists all the time and they would bring the staff in. They go, 'Look at this guy, look at him. He's worn his teeth down.'" I thought, how is that so wrong for this guy? So I made him an appliance to open up his bite so that we could then get the vertical dimension correctly. And he wore this appliance for maybe a couple of months. And he said, and he was in his late 50s. And he said, "I can't believe," he said, "I'm sleeping better." He said, "I used to just think I slept badly because I was getting old. I didn't realize it was related to my mouth." And so he invested in a full mouth rehab top and bottom. Now, I didn't do many of them, but it was such a success for him. It changed his appearance, changed his he became a very relaxed man. He became a very handsome man because of his smile. And he was such a pleasure to treat. And I thought if I hadn't known what to do, I wouldn't have known what to do. And so it's a continuing education, which is really, really important as well, Alicia. And there is so much education now available in dentistry, and the fact that the what causes people to grind their teeth is not they've been touched on the head by a fairy with a grinding wand. There's something physical that's causing that, and so can we identify that? Can we then fix that? Because I was never a big fan of the explanation of toothbrush abrasion. Like it's a nylon brush on the hardest substance in the body. How is that ever going to work? How is that ever going to? You could hold a tooth and a nylon toothbrush and do this. You could put it in a machine, and it's never going to do it. It's got to be abfraction. That it's abfraction that causes those notches up there. And what causes that? It's a physiological airway issue. Feel grinding and clenching. And they say, "Oh, it's stress." And I'm going, is it? Like kids grind their teeth. Little children grind their teeth. They don't have wives. They don't have mortgages. They don't have jobs. Where's their stress come from? It's got to be physiological. It's an airway issue. And so get to the science rather than the cliche of it. So it's exciting times. I've been lucky to live in dentistry. I was 35 years a dentist, 28 of those owning my own practice in the one location. When I left that practice, it was more than half my life in one location. I haven't lived in a house that long. And I grew that practice successfully, and it did help me very, very much have a very enjoyable life. I got to travel, as I told you before, traveled to the United States a lot. So able to travel back to the United Kingdom where my wife was born and still has family, and that's been very enjoyable. Was able to send my children to very good schools and give them a much greater opportunity than I had going to state schools and living out on the outskirts of Sydney and travelling to university. So I know what life's like to struggle, and I'm so glad that I've enjoyed the benefits of have been in dentistry and been able to help people as well as help my community and help in my employees as well. I've given people great jobs. I've given people jobs that they've gone on to even bigger success. Somebody who came to my practice as applying for a front office role who could hardly speak English and had never worked in a front office, and I gave her a job. She's now a dental practice coach, coaching case acceptance. And she says, she thanks me every time she sees me to say, you believed in me when nobody else believed in me. And that was 18 years ago, 19 years ago. And so, the dentistry's been great, and it is a gift. And I think through people like you helping dentists to say, how can my practice be better? As you said, let's start with a vision, and then let's start with what we're going to give our patients. And as we educate those patients, they will then educate their circles of influence, and your practice will grow. You'll be known as somebody a nice place to go rather
Yes.
than of horrors as they used to be. So before we close off, anything you'd like to say in summation? And also, how can people get in contact with you to find out more and if you can help them with their practices?
Absolutely. Thank you again for having me here. And I just want to let dentists know if you're struggling, you're not alone. Like you're sometimes dentistry can feel very lonely as the owner. And I want to let you know you're not alone and that there is not asking for help or guidance on your practice is not weakness. It's actually a superpower. So use that superpower to get the guidance you stand in need of because really I want you to have the most beautiful story. I want you to have the fairy tale ending that you dreamed about when you started dental school. And so use that opportunity to contact, even if it's not me, other coaches, reach out to them because I want you to have the practice that you dreamed of. If you want to get a hold of me, there's a couple different ways. You can reach me through my email at increda.dental@gmail.com. You can go to my website at increda, and that's a -dental.com. And you can sign up for a newsletter that I send out from time to time, like new dental codes or information on ways to communicate better with your team and your staff. And then you can also call me at 208-908-3152. This is a US phone number. I am in Singapore currently, so it's a 1 in front of it. But you're welcome to contact me. I really just want you to succeed. I want you to have the practice you desired because you deserve it and your patients deserve it. And nothing's better than when that comes together.
You're right, Alicia. Nothing is better. It is a great opportunity to help people. It's a great opportunity to help you yourself as a dentist to live the lifestyle that dentistry can provide you and to help your community. And even a successful practice still has to spend money, and that generates business in the community as well. So everything flows on. But it's been a pleasure talking with you. Thank you.
Yeah,
Thank you so much.
yeah, thank
I hope
you.
that my listeners get something out of this. There's plenty of pearls there. Your passion is palpable. You believe you had a very hard life experience early with your father, and I think that to take that and say, I need to help dentists to have a better life than my father and not to become a statistic like my father. I think that's truly admirable because it is possible. It is very possible to have a great lifestyle as a result of being a good dentist and running a good business. So, Alicia Flynn, thank you so much for joining me today on the Ultimate Dental Podcast. It's been fun.
It's been a blast. Have a great day.
Yeah, same to you. Thanks so much.
Thank you.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.